Androgenic alopecia, also known as pattern hair loss, affects around 50% of men and 30% of women aged by 15. It is most common type of hair loss. It is 95% of cases of hair loss. Androgenic alopecia is more common among Caucasians and much less common among Asians, Africans, and Native American populations. Two most common types of androgenic alopecia exist. First is male pattern baldness, and second is female pattern baldness. Male pattern baldness characterized by receding hairline. It means receding hairline, such part, frontal part of the head, and thinning of the crown. Crown is here, thinning of the crown. While female pattern baldness is diffuse thinning across the scalp. So here are thinning everywhere across the scalp. We have classifications according to phases and severity of progression, which we measure Norwood-Hamilton scale in case of males, and you can see this scale is first phase, second phase, third phase. The higher phase, the higher hair loss. And we measure and we can assess female pattern baldness with Ludwig scale for women. You can see it's first phase, second phase, and third phase. What is the mechanism of action? How androgenic alopecia works? Most important factor here is genetic predisposition. Genetic predisposition increases hormonal imbalance, and other factors also exist, aging and diseases. For example, polycystic ovary syndrome. And what they are doing, the main idea is that increased level of dihydrotestosterone, and dihydrotestosterone derived from testosterone. On testosterone affects 5-alpha reductase, and we get dihydrotestosterone or DTH. The higher DTH, the higher androgenic alopecia. Because DTH binds to androgen receptors on hair follicles, and it is called miniaturization. It means it reduces size of hair follicle, it reduces function of hair follicle, and hair becomes more fragile, more thin, and eventually it sheds. Also, DTH shortens the hair's growth cycle. Eventually it causes pattern loss. And here is question that why there is different patterns in case of male and female. In case of male, there is receding hairline, thinning of the crown, while in female we have diffuse thinning. What's the mechanism? What's the important factor? There is simple explanation that androgen receptor distribution is different. Men tend to have higher concentration of androgen receptors in the frontal and crown areas, while in case of females we have androgen receptors diffuse on the scalp. Now let's answer one of the most common questions about androgenic alopecia. First is which is Which age is early hair loss? If hair loss occurs earlier than 30, it's early hair loss. Hair loss and obesity, how much they are correlated? There is direct correlation between hair loss and obesity, and it is thought that it's because of hormonal imbalance, inflammation, and oxidative stress. Obesity increases risk of hair loss and androgenic alopecia. Third question is if alopecia has direct correlation with hair graying. Even alopecia and hair graying both are age-related, they have no direct correlation. Now let's discuss treatment. Treatment in case of males. First line of treatment is topical minoxidil. 5% is more effective. It is vasodilator and promotes hair growth. So vasodilation of the skin means stimulate of hair follicles, more blood, more nutrients there, so it stimulates hair growth. Side effects include irritation and itching. Usually it's local irritations only and nothing important. Another treatment is oral finasteride. Oral finasteride inhibits enzyme 5-alpha reductase. We already talked about 5-alpha reductase. Here 5-alpha reductase is needed to convert testosterone into dihydrotestosterone. So if we inhibit 5-alpha reductase, it means we inhibit production of dihydrotestosterone. Oral finasteride has unfavorable side effects and adverse effects. It's decreased libido, erectile dysfunction, and ejaculation disorders. We need to double think before intake oral finasteride. Next treatment form is low-level laser therapy, LLT. There is some researches according to them it effectively promotes hair growth. Another treatment is platelet-rich plasma therapy. It means we inject patient's own platelet-rich plasma into the skin, into the scalp. It promotes hair growth. And last option is hair transplantation or surgery. In case of females, topical minoxidil here is also first line treatment, 5%, also 2% topical minoxidil exists, but 5% is more effective. It's vasodilator and promotes hair growth. Spironolactones also used. Spironolactones are anti-androgens, especially in case of polycystic ovary syndrome is effective because such cases we have high androgens and we need anti-androgen. Hormonal replacement therapy sometimes effective, especially in case of menopause. Low-level laser therapy, platelet-rich plasma, and hair transplantation. Here is also standard therapy as in case of men. That's all. Thank you for your interest. Thank you for your watching. If you like my video, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.